Hi everyone, welcome to a brand new video. In this week's video, I want to address the topic of endometriosis. It's a question you guys send to me here on YouTube all the time, so I thought it was a great one for us to dive into. One of the big questions I want to answer for you today is, what the heck is endometriosis? And does that mean that I can or cannot take hormone therapy in perimenopause and into menopause? Even if you don't suffer with endometriosis, I think this is an excellent topic to know about. And I know you, my army of women, want to know every single thing. So if you're interested in today's video, definitely stick around. I can't believe we've surpassed 10,000 subscribers here on Health by Heather Hirsch. We did that actually a while ago, and so I'd like to do a Q&A when we hit 15,000 subscribers. Now, as I sat down to write my goals for 2022, I set a really lofty goal of hitting 100,000 subscribers on YouTube. I want to do that not for me, but because I know if there is so many women subscribed to the channel that we're really making a difference in terms of increasing education around perimenopause and menopause, hormonal issues, hormonal imbalance, hormone therapy, as well as just making you stronger, more educated, and empowered to have even better conversations with your friends, family members, and doctors. Let me know in the comments what other topics you guys definitely want to hear about, because I will add them to the queue as I'm going through for 2022. I'm also thinking about starting a second channel where I can put up my podcast episodes. I record a lot of them, and I'm wondering if that's something you guys would be interested in. Let me know. Okay, so what is endometriosis? Well, in plain terms, endometriosis is when the lining of the uterus, which is called the endometrium, and is made up of all types of cells that either help us sustain a pregnancy, they build up, and then when there is no pregnancies, those cells slough off and shed, which is when we get our period or when we menstruate. So they're very hormonally sensitive. So endometriosis is when that tissue, that endometrial tissue, is in places outside of the uterus. Why would that be a problem? Well, because it's going to act just like that uterine tissue in places where it really doesn't need to. And it's responding to your body's hormones, the changes in estrogen and progesterone during ovulation that can cause a lot of symptoms for women who have endometriosis. It's really common that this type of tissue can surround the fallopian tubes, sometimes engulf the ovaries, or even be in the pelvic floor. When that happens, as those hormones are changing each month when you're premenopausal, even perimenopausal, that means that all that tissue is responding to those hormones. And that means for you that that can be really painful. So if we already know that cramps, which happen before our period, which is the uterus way of really actually squeezing those muscles so that you can shed that lining. If you have that in more tissue than just your uterus, you're going to typically have cyclic or cycled pain right before your periods. Now, this isn't just any type of pain. If you ask me, I think we tell women to suck it up way too much. But my women who have endometriosis typically have severe pain that will keep them from engaging in their daily activities 1, 2, 3, 4, 5, sometimes even longer days a month. Now let's just even say, it's a severe case and 5 or even 3 days leading up to your period, you can't do very much, including go to school or go to work, take care of your children. That, when you add it up, is a lot of the year. So you're spending a lot of time dealing with the pain and frustration of endometriosis. And if any of you watching this video have suffered with endometriosis, you know exactly what I'm talking about. There are even severe cases of endometriosis. We stage these from 1 to 4, and I have seen very severe and rare cases of endometrial tissue in the colon, found on colonoscopy, and even in the lungs, found on lung biopsies. Now, those are very rare, but it definitely means that this type of tissue can spread and cause lots of unanswered symptomatology for women with endometriosis. There are also women who have endometriosis that we could see if we did a laparoscopy and went into their belly, but didn't know it. So actually there are some women probably with early stage 1 or stage 2 endometriosis that may not even know they have it. We care about endometriosis a lot because one other thing that's very worrisome, not only is it debilitating symptoms and the effect that's going to have on your work, your productivity, and quality of life, but on the ability to get pregnant. Now, I'm not a bona fide endocrinologist and infertility doctor, so I really don't know the data on how much endometriosis affects infertility, but it's certainly something that I see as someone who deals with perimenopause and menopause a lot when women kind of look back at their menstrual cycle to tell me what happened with them during that time. Common treatment for endometriosis is birth control pills. So on first glance, you may think if it's the hormonal swings and the hormones that are causing this endometrial pain, why the heck would I use birth control pills, which is essentially a combination of estrogen and progesterone? Or you don't have to use birth control pills. You could use systemic progesterone, and those could be the progesterone only mini pill. You could do a depot injection, or some women choose to do the arm implant called the Nexplanon, which is also systemic progesterone. Now, the reason those work is actually because what they do is stop you from ovulating. And you ovulate when your hormones kind of have this up and down type pattern. Birth control pills or all those progesterone options actually make your hormones go more like this. So they're super, super steady. When they're steady, you won't ovulate. When you don't ovulate, you won't have that cyclic response to the hormones that causes endometrial pain. Unfortunately for some women, sometimes this doesn't work, sometimes it works great, or sometimes they have to go through a couple different types of these methods to find something that works. We'd love to keep you away from surgery if possible, and so a lot of times medical management is something a lot of women with endometriosis have attempted or tried. In very extreme cases, we'll even try a medication called Lupron, which is going to put you into chemical menopause. Now, the thing with that is a little tricky is because it's going to completely shut down any type of ovulation, but it's also going to make you be in a low estrogen state. So you can then have menopausal symptoms like hot flashes and night sweats. That's really common. So with all that being said and done, can you use hormone therapy once you are postmenopausal? A lot of people think the answer is no, but actually it is not a contraindication to hormone therapy. For some of my patients, it's a little triggering because the idea of just adding more hormones, which historically have led to this chronic pain, which for many women can be sort of traumatic over their lifetime, the word hormone or hormone therapy just automatically makes them say, no, no, thank you. And if that's you, that is absolutely fine. The decision is completely yours. But if you are really symptomatic or you're otherwise interested in hormone therapy, there is no reason you can't use postmenopausal hormone therapy. The reason postmenopausal hormone therapy is okay is that postmenopausal hormone therapy does not make your hormones do this again. That is actually the biggest problem with endometriosis, is the up and down. Postmenopausal hormone therapy, especially estrogen, is this teeny tiny level of estrogen. And what we like to do is give you that in combination often with the progesterone to keep them nice and balanced so that it doesn't flare any residual endometrial tissue that's mostly gone to sleep once you go into menopause. I do this all the time, and typically what I want to do is make sure that their hormone therapy is not inducing any kind of dull pain or cramping. In reality, it very infrequently does. And if it does, we lower the dose even more so that what we can do is balance relief from the menopausal symptoms and benefits of the estrogen therapy after menopause without flaring any type of pain. I have great success doing this. So it is not by any means a contraindication to using hormone therapy. Now, what if you've had a hysterectomy? If you've had a hysterectomy, potentially for endometriosis, which is very common, a lot of times, even though you don't have your uterus, I will use estrogen and give you a progesterone as well. That just kind of helps to maybe counterbalance any estrogen in the case that, again, there's any endometrial tissue left in the pelvic floor or anywhere, depending on what kind of surgery you had. And I gotta be honest, many of my patients do really great. I actually have not had to stop anyone's postmenopausal hormone therapy because of a prior history of endometriosis, no matter how severe. If you are still feeling confused, stuck, frustrated with your doctor, perhaps you want more information on this and you want to take a deeper dive and get support with me, or your doctor is telling you that it's a contraindication and won't prescribe hormone therapy, but you're very interested, I definitely want you to consider joining me on a call for the Reclaiming Menopause Masterclass, because that's exactly what I do with my students. I help you go from feeling confused, frustrated, stuck, and symptomatic to being symptom-free, educated, and empowered. It's a wonderful opportunity to get support from me and meet a bunch of other women across the globe, all there to support you on your journey. If that is you, click the link in the description below. Thank you guys so much for listening. Please subscribe to the channel if it's been helpful. Please share my videos. Help me reach my goal of 100,000 subscribers either soon or in the near future. I love you guys so much. Thank you for watching all my videos, and I'll be back next week with a brand new one for you guys. Bye, everyone.